Hi, I'm Tova Laufer. I work for EMH Physical Therapy, where we specialize in pelvic floor physical therapy. Today I'm going to talk about some tips regarding exercise while you're pregnant. And the most important thing is to first consult with your physician to make sure that you're in a position to work out. If you haven't been working out prior to pregnancy, this isn't the time to start. So you want to make sure that you clear with your physician that you can maintain the level of exercise that you were at previously. And some things just to be aware of that they want to make sure is that the cervix is intact, that you're not having lightheadedness or shortness of breath while you're exercising. Exercise has been shown to be excellent for pregnant women. It can help ease labor, reduce fatigue, increase blood flow, and keep the cardiovascular system healthy and strong. And so the guidelines recommend that you work out at least 3 times a week at a moderate level, and that you do reps that are moderate, 1 to 3 sets depending on your level of exercise, and that you do a 5-minute warm-up and a 5-minute cool down, making sure to keep blood flowing and avoid blood pooling in the legs and potentially avoid dizziness, lightheadedness, or having blood clots in the lower extremities later. So you want to make sure that you're not doing anything that is too strenuous, too heavy in weight, that would cause any kind of separation of the abdominal muscles. If you're getting any sort of incontinence, that's a red flag. Any shortness of breath, any severe pelvic pain or bleeding, those are all contraindications to exercise. 2 other things to take into consideration is that you want to make sure that you remain active during your rest breaks. So don't just sit down and put your head down. You want to avoid that blood pooling and lightheadedness, and the same thing goes for position changes. So if you were on the floor, you don't want to rapidly just stand up. You want to make sure you do it in small motion increments so that you avoid the blood pooling and the lightheadedness, because position change can tend to cause dizziness and you want to avoid fainting. When designing your exercise program, you want to make sure that you're doing full body exercises rather than focusing on the upper body or the lower body on individual days, because again, you want to create that blood flow and avoid blood pooling in certain areas. Additionally, you want to make sure that you're not overstretching either before or after, because all of a sudden you have all these hormones running through your system, and now you can have some ligamentous laxity, especially in the pelvis area. And you don't want to overstretch and cause any injury now that you're suddenly more flexible. And those are my tips for exercise during pregnancy.